So I'm joined now by Mohamad Hamade, who is CEO of Amanat Holdings, a Dubai-based private equity group. You're focused then on health and education services in the Middle East. Saudi has been big in the news in terms of investment opportunities. What's it like there? What sort of opportunities are there?
So thank you, pleasure being with you. Saudi is definitely the largest market in the GCC. It's around 60% of the market. And when it comes to the healthcare opportunity there, I think it's tremendous. And that is driven by demand drivers, but also a limited supply. On the demand side, I think if you think of it from a demographic perspective, from a social perspective, and a regulatory perspective, they all support increasing demand moving forward. Demographically, it's a young population that's growing and will require more and more healthcare as they age. Socially, I think people are becoming much more aware and health conscious, especially after COVID. Health became center stage to many people, and that results in increased demand on healthcare. And from a regulatory standpoint, I think having healthcare insurance, private healthcare insurance and financing also further supports more demand. However, on the supply side, it's quite limited. And as such, I think if you put this and that together, you realize that there's a tremendous opportunity to invest in the healthcare sector in Saudi Arabia.
What does it take then to be successful in that area? Are there any barriers to entry, particularly perhaps for countries outside the Middle East?
I wouldn't say there are barriers to entry, but there are key success factors to entry. So for players like us, we're regional players. We have the local connect. We are plugged into the developments of the market. We understand how to navigate certain challenges or barriers otherwise. Whereas for international groups who have tried to directly enter the market, I think they might be faced with frustration before resulting in a success. And I think the right formula would be for international operators and or investors to partner with local investors and operators who have feet on the ground, who have a local connection and local presence and are up to date on the various development. I think this is a very, very important element to determine success to enter the market.
And we're hearing more about this at the conference here, about partnerships, about collaboration, and perhaps post-COVID, where companies are more open to collaboration, realizing that the results have got to be done as teams. And what else then? What other opportunities in the region? Anything else that's exciting coming up there?
Look, this is an excellent point. I think partnership between private and sovereign has become much more relevant these days. So it's true. Operators, I'll give you an example. Investors/operators like us, if we are to add a new service or enter a new medical specialty, we come to here and other Western countries and try to identify partners to collaborate and bring them in. Very similarly, locally, we partner with the public sector. So with government hospitals, government players, trying to complement the skill set between both of us for the better interest and the mutual interest of both parties. So that said, don't think that there's no competition. There is still ongoing competition. But truly, I believe that the market potential allows for the various competitors to grow and also leaves a lot of room for partnership and collaboration.
And you mentioned a youthful population that will age. Are there any particular sectors where there are opportunities, any particular aspects of healthcare that you see as big openings?
I mean, we are heavily invested in post-acute care and rehabilitation. This is a sector that we've deployed more than $1 billion dirhams in that space. And we currently own the largest player in the UAE and Saudi in this sector. This is a market or a sector that is nascent in the rest of the GCC. It's very well established in Abu Dhabi. It's starting in Saudi Arabia, but it's completely nascent in the remainder of Saudi Arabia, in Qatar, in Kuwait, in Dubai, in the Northern Emirates, and the rest of the Gulf. So just as anecdotally as an example, the market need is north of 20,000 beds for this sector. So I believe this is long-term care and rehab is definitely a very promising sector. And we were chatting earlier, throughout the continuum of care, down to home care, is all one synergistic complementary service offering that I believe is a very interesting one. Another one could be in the tertiary care space. So while secondary healthcare is quite saturated to some extent in certain markets, tertiary healthcare is completely underserved. So there is a very obvious opportunity in specialized healthcare. To name a few, I would say in oncology, definitely. In certain advanced surgical specialties, definitely. This is just to name a few.
Wow, there's some great opportunities. It's lovely to hear about them and to meet you. Thank you so much.
Pleasure being with you. Thank you.
You.